Okay. Good morning, Dr. Dunn. I'm Patty Melde.
Veronica Elstra.
You know, hopefully you remember us. We're going to be doing our head to toe today with each other. We've decided to just go right into the head to toe physical exam since that's what you're going to be grading us on, and you have a lot of these to look at, so instead of going through subjective. Just going to give you a little introduction. The MA has already done her vital signs, and Veronica is a 44-year-old female, date of birth 7/9/1969, practicing Catholic, registered nurse, employed at a local hospital, and unaccompanied to the appointment today. And the reason to be seen is a wellness exam to be cleared to enter the NAU FNP graduate program. She's came in and she was dressed and groomed well, dressed for the season, appropriate for the season. Her hearing and her vision are appropriate. She's a reliable source. So we're going to go ahead right into it. So, hello, Veronica.
Hi, Patty.
We're going to be doing your physical today, so that we've already talked about other review symptoms and so forth. And so what I'm going to do is start from your head down to your toe.
Okay.
I'm going to check all your systems. And so I'm going to actually start with your skin.
Okay.
And I'm just going to be observing. And it's pink, tan, and very healthy, soft, dry, perfect. And the skin turgor, prompt response, capillary refill, very, very good. Okay, now we're going to start with your head. I'm going to just be palpating. Anytime I do any palpating or touching, if there's tenderness on any part of your body, please let me know, because that's very important for me to know. Okay. And I'm going to be looking at the cleanliness. Your hair is very clean, no pest inhabitants. Just looks great. Okay, that's wonderful. And your head is midline and normal cephalic. Then we're going to actually do your face, and I have a couple of tests that I want you to do.
Okay.
So lift your eyebrows. Perfect. Okay. And then I want you to close your eyes, and I'm going to try to force your eyes open. Please keep them closed. Good. And then puff out your cheeks. Smile. Show your teeth. And I'm going to test your TM joint here. So just open and close. Good. Perfect. No clicking at all. Okay. And then I'm just going to test your sensation. So I'm going to use soft and sharp, okay, and it won't hurt. Keep your eyes closed and tell me what you feel.
Sharp. Sharp. Soft. 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 Sharp.
Perfect. Good. Okay. Now we have a little test called the Snellen test. It's your visual acuity. And I have a little card here. I want to check your pupil size. Oh, great. So your pupils are about 3 centimeters. And then I want you just to read the lowest line that you can. Uncover your eye.
Okay. D-E-F-P-O-T-E-C.
Okay. And cover the other eye.
D-E-F-P-O-T-E-C.
Perfect. So 20/20 vision. Okay. Now another test that I'd like to do is I'd like you to follow my finger. Okay.
Okay.
So, oh, there you go. Good. Didn't make you dizzy?
Mm-mm.
And then follow the finger in. Perfect. Good job. All right. So I'm going to use a pen light. I just want to check the constriction of your pupils to see if they're even. All right. And we have the light turned down. Good. All right. Then we're going to actually look inside of the eye. And I see on the outside there's no drainage, sclera is white, everything's clear, it looks great. So go ahead and look over my right shoulder.
Okay.
There's no ED nicking, there's no hemorrhages, exudates, and it's the fundus looks very clear and sharp. The disc margins are sharp and very clear. So let's go here again. And that eye, the same with that eye. It's very clear and no hemorrhages and no exudates, no baby nicking. Yes. So your eyes are healthy.
Okay.
Okay, so next we're going to actually check your ears. I'm going to palpate a little bit on the outside just to make sure you have no lumps or tenderness. Everything feel okay there?
Mm-hmm.
Okay. Right. Very clear. The tympanic membrane is pearly gray, and the landmarks are intact in that eye or ear. Cone of light again on this one, pearly gray, and landmarks are intact. So your ears look great. All right. So we're done with that. Let's go ahead and look at your nose. So change your little. Okay. Just gonna look up your nose just to make sure there's no lesions or. Nares are patent, sorry. Okay. Pink, mucosa, everything looks great. So, and now we're going to actually be looking into your mouth and check your teeth. Good. Glasses back on, that might help. Mucosa is pink, and teeth are, dentition is in excellent condition. Lift your tongue underneath, everything looks great. Okay, and then just stick your tongue out and say ah. Great. Soft palate and is pink. Okay, moist. Great. Good job.
Right.
Okay. So now we're going to do your neck. I'm going to check your lymph nodes.
Okay.
I'm not pushing too hard.
Mm-mm.
Okay. You haven't noticed any lumps, lesions. Okay.
No.
Good. Actually, I'm just going to go ahead and listen to your carotid arteries.
Okay.
2+, sounds great.
Wonderful.
Strong. Okay. And then I'm going to have you, I'm just checking for your the visualization of your thyroid. So I want you to take a drink of water
Okay.
or hold it in your mouth, put your chin up a little bit, and then go ahead and swallow.
Okay.
to go to the back.
All right.
So you don't move, I do. I'm going to palpate your thyroid. I just want you to lift up your shoulders for me. Perfect. Okay. That's good. And then I want you to do a range of motion with your neck. So would you touch your chin to your chest, go back, extend your neck back, and then touch your ear to your right shoulder, touch your ear to the left shoulder, and then turn your head back and forth. Good. And then I'm going to put my hand here, and I just want you to go ahead and try and push against it. Perfect. Okay. Now I'm going to just go ahead and check your muscles in the back and your spine. Everything looks great. Spine is straight. Okay. And then I'm going to listen to your lungs. Okay. And then just every time I move my stethoscope, go ahead and take a deep breath in and out. There you go. Lung fields sound very clear. And then I'm going to actually check any flank pain you might have back here. No? Okay, and then I just want to make sure that everything's equal, and so go ahead and take a deep breath in and let it out. Again. Okay, everything looks very nice. So I'm going to come back around and I'm going to check your and I will percuss. I forgot, Dr. John, I'll percuss. I'm not sure we needed to, but I'll go ahead and percuss. Just so you know I know the technique. Okay. Okay, so we're going to do tactile fremitus. I'll do it in the front. So go ahead and say 99.
99.
99.
99.
Good. Everything's very resonant and equal. I'm going to go ahead and listen to your lungs in the front. Okay, the same. When I move my stethoscope, go ahead and take a breath in and out. So your lungs sound very clear and healthy.
Great.
So what we'll do now is we're going to go ahead and go into the cardiac assessment.
Okay.
And so I'm just going to be actually listening to your breath, your heart sounds.
Okay.
And then we're going to do some. I'll do your pulses.
Okay.
Up and down. And then we should be finished with that part.